This video demonstrates how to set up and perform an ultrasound scan of the thyroid and parathyroid glands. Equipment required includes the following: an ultrasound machine, a selection of transducers, an examination table, positioning aids such as pillows or sponges, an ergonomically adjustable chair, acoustic gel, examination gloves, bed linen and towels, and a sonographer's worksheet. Select the appropriate transducer for the thyroid examination. Select the standard preset for thyroid and parathyroid sonography. This may be listed as small parts in some machines. Select the appropriate setting for a thyroid scan. Explain the technique of swallowing to the patient, as it will be done during the ultrasound procedure. Ask the patient to lie supine on the examination table. Make the patient comfortable. Sit or stand on the patient's right side with the ultrasound machine to the left upper end of the examination table. Place a sponge, small pillow, or rolled towel under the patient's neck and shoulders. Turn the patient's head away from the side being scanned to increase the visibility of each lobe of the thyroid. Expose the neck and apply gel to the anterior neck region from the sternal notch to the mandible. Select the high-frequency linear broadband transducer. Confirm the correct transducer selection preset. Perform a survey scan of the neck and make the necessary adjustments to the machine settings to maximize image quality. Once complete, proceed to scan the thyroid and parathyroid glands. Place the transducer over the anterior neck area, slightly off the midline, in the transverse plane. Manipulate the transducer until a suitable image of the thyroid is obtained. Slide the transducer systematically superiorly towards the mandible and assess the medial aspect of the thyroid. Then slide the transducer inferiorly towards the clavicle and assess the lateral aspect. Continue moving laterally until the entire thyroid lobe is visualized and the common carotid artery and the internal jugular vein are clearly identified. Freeze the image. Annotate the scan plane, patient position, and structures identified. Measure the maximum width by placing the calipers on the medial and lateral aspect of the widest part of the thyroid. Measure the maximum antero-posterior, or AP dimension of the lobe by placing the first caliper on the anterior edge and the second caliper on the posterior edge of the thyroid. Save the image and unfreeze to continue scanning. Place the transducer above the sternal notch in the transverse plane and move superiorly to view the isthmus. Freeze the image and annotate accordingly. Measure the AP dimension of the isthmus by placing the calipers at its anterior and posterior margins. Save the images obtained. Repeat the above steps on the opposite side while still in the transverse plane. Next, scan the thyroid in the longitudinal plane. Place the transducer above the sternal notch, slightly off the midline, with the lower edge of the transducer at the level of the sternal notch. Assess the lower pole by sliding the transducer systematically from the midline towards the lateral aspect of the neck, past the thyroid, common carotid artery, and internal jugular vein. From the lateral aspect of the neck, move the transducer upwards towards the mandible and slide the transducer towards the midline to assess the mid and upper poles, including the isthmus. Repeat this maneuver until the entire thyroid has been visualized. Identify the long axis of the thyroid, freeze the image, annotate, and measure the maximum length of the lobe by placing the calipers on the superior and inferior aspects of the lobe. Save the images obtained. If pathology is noted, describe the ultrasound characteristics of the lesions, document and measure as necessary. When appropriate, use color flow and spectral Doppler to assess the vascularity of the pathology. Repeat the above steps on the opposite side to scan the thyroid in the longitudinal plane. The parathyroid glands are not commonly identified on ultrasound. The thyroid imaging technique is used, focusing on the possible locations of the parathyroid. The parathyroid glands are commonly located along the tracheoesophageal groove. Angle in from the lateral neck and search along the tracheoesophageal groove. Image the parathyroid gland in both the longitudinal and transverse planes. Ask the patient to swallow in order to raise the lower pole of the thyroid and to differentiate the esophagus from the parathyroid. Freeze the image. Annotate the scan plane, patient position, and structures identified. Measure the width in the transverse plane by placing the calipers on each opposing edge of the widest part of the gland, and then the AP diameter by placing the calipers 90 degrees to the width. In the longitudinal plane, measure the greatest length of the identified parathyroid gland. Document on a worksheet the location of the parathyroid glands. Save the images obtained. Scan the neck region in the transverse and longitudinal planes using the same technique. Record images of any neck masses as required. Slide the transducer systematically along the clavicle to the acromioclavicular joint, where most lymph nodes are found. Angle the transducer inferiorly from the clavicle to investigate the infraclavicular area. Determine whether lymph nodes are intrathyroid or extrathyroid and describe the ultrasound characteristics. Document and measure them as necessary. Freeze and annotate the image, then measure the length, width, and antero-posterior dimensions of any lymph nodes or masses identified. Save the images according to protocol. At the end of the procedure, give the patient a towel or cloth to wipe off the gel. And complete the post-scan requirements.